Welcome to Medicare Mondays. This segment is pre-recorded. This month we will discuss important tips to consider prior to Medicare Open Enrollment. What is Medicare Annual Enrollment Period, or AEP? Medicare's Open Enrollment Period, or OEP, runs from October 15th to December 7th each year. The OEP is sometimes also called Annual Enrollment Period. The changes you can make include: you can join a new Medicare Advantage plan or standalone Part D prescription drug plan. You can switch from original Medicare to Medicare Advantage. Or you can switch from Medicare Advantage to original Medicare with or without a Part D plan. The last change you make by December 7th will take effect on January 1st, 2026. If you need help, sit down with a trusted person, a relative or friend, or Rhode Island SHIP counselor. You can call 1-888-884-8721 to find the closest one to you. Review your coverage for 2026. Regardless of how you receive your Medicare coverage, you should consider your access to healthcare providers you want to see, your access to preferred pharmacies, your access to benefits and services you need, the total cost for insurance premiums, deductibles, and cost-sharing amounts, and the quality of the customer service you receive. For Original Medicare, you can visit www.medicare.gov or read the 2026 Medicare and You Handbook to learn about Medicare benefits for the upcoming year. For Medicare Advantage or Part D plans, read your plan's annual notice of change and evidence of coverage. You will get this in the mail by September 30th each year. Considerations when choosing a new Part D drug plan. Ask yourself the following questions before choosing a Part D plan. Does the plan cover all medications I take? Does the plan have restrictions on my drugs, for example, prior authorization, step therapy, or quantity limits? Prior authorization means that you must get approval from your Part D plan before the plan will pay the drug. Step therapy means that your plan requires you to try a cheaper version of your drug before it will cover the most expensive one. Quantity limits restrict the quantity of a drug you can get per prescription fill, such as 30-day pills of drug X per month. Also consider how much will I pay for monthly premiums and the annual deductible. How much will I pay at the pharmacy regarding co-pays, co-insurance for each drug I take? Is the pharmacy in the plan's preferred network? Can I fill my prescription by mail order? If I have a retiree coverage, will the Medicare drug plan work with this coverage? Some considerations when choosing a new Medicare Advantage plan. Ask yourself the following questions before choosing a Medicare Advantage plan. How much are the premium, deductible, and coinsurance copay amounts? What is the annual maximum out-of-pocket cost for the plan? This amount may be high but can help protect you if you have expensive health care costs. What service area does the plan cover? Are my doctors and hospitals in the plan's network? What are the rules I have to follow to access health care services and my drugs? Does the plan cover additional health care benefits that are not covered by original Medicare? Will this plan affect my additional coverage I may have? What kind of supplemental benefits do Medicare Advantage plans offer? A Medicare Advantage supplemental benefit is an item or service not covered by original Medicare. These benefits do not need to be provided by Medicare providers or at Medicare certified facilities. There are different types of Medicare Advantage supplemental benefits you may receive, like commonly offered primarily health-related benefits, which include dental care, vision care, hearing aids, and gym memberships. These Medicare Advantage supplemental benefits can be available with no additional premium. However, some Medicare Advantage supplemental benefits are optional and require paying an additional premium. This is often the case for dental and vision benefits. Less commonly offered are non-primarily health-related Medicare Advantage supplemental benefits for beneficiaries who have chronic illnesses. These benefits address environmental factors that may affect your health, functioning, quality of life, and levels of risk. Examples of these benefits are meal delivery, transportation for non-medical needs, and home air cleaners. Star rating for Medicare Advantage plans and Part D plans. Star ratings are quality ratings that provide a measure of a plan's performance. Medicare scores Medicare Advantage plans and Part D plans in several categories, including quality of care and customer service. Ratings range from 1 to 5 stars, with 5 being the highest. Medicare assigns plans an overall star rating to summarize the plan's performance. Plan ratings change from one year to the next. Medicare reviews plan performances each year and releases new star ratings each October. Please note, plans with a star rating of 3 and below may not be offered the next year. How to review and change your coverage. You can use the Medicare Plan Finder, which is an online tool that helps you look up and compare plans in your area. To access the Medicare Plan Finder, visit www.medicare.gov/plan-compare. Medicare Plan Finder gives you the option to search using your account or to continue a search without logging in. The personalized search requires you to log into your Medicare account or make an account if you do not have one. Once you are logged in, Plan Finder will save your search results and you can access them later. The basic search requires your zip code and the type of plans you want to compare. Your search results will not be saved or accessible once you close the page. Once you enter your information, you will be able to compare a list of plans available in your area. Before using Plan Finder, create a list of healthcare professionals you see, drugs you take, and pharmacies where you get your drugs. This will allow you to compare your options. Additionally, when you decide on a plan, you should call 1-800-MEDICARE or use Medicare.gov to enroll in that plan. It is helpful for Medicare to have the official enrollment record in case there are any problems. You can contact your state health insurance assistance program or SHIP if you want one-on-one help reviewing your options or making changes. SHIPs are funded by the government to provide trusted, unbiased Medicare counseling. You can contact Rhode Island SHIP at 1-888-884-8721. Protect yourself from marketing violations and misleading marketing. During Medicare's open enrollment, health insurance companies try to reach people in various ways, like television commercials, radio ads, events, mail-ins, phone calls, and text messages. The Centers for Medicare and Medicaid Services, or CMS, has rules for marketing Medicare Advantage plans and Part D plans. These rules protect Medicare beneficiaries from aggressive or misleading marketing. Plans are allowed to send you mail. They also email or call you about other health plans and products as long as you are already a plan member and haven't asked them not to call or email. Plans are not allowed to call or visit you in person to market their products without your permission. Plans who call or send emails must provide an opt-out option for people who no longer wish to receive them. Tips to help you avoid marketing violations and misleading marketing. Watch out for people who pressure you to join their plan, tell you they represent Medicare or are calling on behalf of Medicare, call you or visit your house without your permission to offer services or equipment, offer free consultations only to people with Medicare and ask for your Medicare number, claim you are missing out on entitled plan benefits, inform you that you will lose your Medicare benefits unless you sign up for a certain plan, or require you to provide contact information at an event for a plan. Note that contact information provided for raffles or drawings may only be used for that purpose. Who to contact if you have any questions. You can reach your State Health Insurance Assistance Program or SHIP if you have questions about any notices you receive. SHIP counselors can also help you use the Medicare Plan Finder to review your options and pick a plan that meets your needs. You can contact your Senior Medicare Patrol or SMP if you have experienced potential Medicare fraud, errors, or abuse. SMP representatives can teach you how to protect yourself from Medicare fraud. You can call the Rhode Island SHIP or SMP line at 1-888-884-8721. You can also call 1-800-MEDICARE if you want to change your coverage during open enrollment. You can also call Medicare for help finding plans in your area. You can also reach your Medicare Advantage plan or Part D plan if you have questions about benefits, coverage, or costs. If you need assistance during Medicare Open Enrollment, contact any one of our community partners listed here. Agent Well in Woonsocket, the Johnston Senior Center, West Bay Community Action Agency, South Kingstown Senior Center, Westerly Senior Center, the Rhode Island Aging and Disability Resource Center, East Bay Community Action Agency, Leon Matthew Senior Center in Pawtucket, Progresso Latino in Central Falls, the Edward King House in Newport, or you can reach our Rhode Island SHIP and SMP line at 1-888-884-8721. Thank you for attending this presentation. If you have any questions, please contact the Rhode Island SHIP and SMP line at 1-888-884-8721, or you can reach Jennifer Reyes, the SHIP and SMP Volunteer Coordinator at jennifer.reyes@oha.ri.gov.